Hi, I'm Dr. Tim Love, and I'm talking today about hair transplant donor sites. The hotbed of controversy about hair transplants today is simply about the donor site, FUE versus FUT. So you people that are out there interested in hair transplants, I think you're familiar with that terminology. All the new technology and infusion of capital in hair transplantation relates to the donor site only. Claims made regarding superiority of FUE donor sites have not been substantiated regarding subsequent scarring compared to FUT. And further, data would support that FUE grafting techniques produce inferior graft quality and poorer graft retention, poorer hair growth as a consequence. Hair transplant patients don't have hair to waste. So as a means of trying to educate the public, what I'd like to do today is show you a gentleman who had hair transplant done by us several years ago, show his results on the crown, but also demonstrate what I consider to be an average quality FUT linear graft donor site. So we're going to pan the camera down and we're going to supplement this with some pictures in this video that show recipient sites to the crown and the 1 and 2 hair graft quality that he has received. But the point of today's video is to show, to show, in fact, the absence of any definable linear scar present there. The reason is that is I'm a plastic surgeon trained in plastic surgery, and the donor site is closed the same way I would close a donor site on a hair transplant. You bevel the incision so that hair grows through the scar and leaves you with a minimal presence of any type of linear line. So if somebody can tell me exactly where his donor site is on this scalp, I would greatly appreciate it. The current advertising that you guys see for FUE is a bald head with a terrible linear scar. Who would want that? Nobody would. What they don't show you is if they show you a bald head with 2,500 or 3,000 white chickenpox scars where they've taken a circular graft out of your head, they don't want to show that. So let's be fair about the issues of donor site quality with FUT and FUE. There are roles and there's times to use each of those techniques, but in general, FUT remains the gold standard. It's the highest quality graft harvesting technique. It's the best quality return in terms of lowest failure rate, highest graft growth rate, and the donor sites are highly acceptable when done by a skilled hand and not by a machine. Thank you for listening. I appreciate you letting me use you as a model.